When it comes to mental health in the US, there's a lot of talk and little action. Many fault mental illness for things like mass shootings, even though most mentally ill are not violent. But few point out that every year, close to 44 million adults will experience a mental illness, and less than half will receive care. And 40% of those with severe mental illnesses like schizophrenia or bipolar disorder won't get the help they need. Compared to 50 years ago, there are far fewer people in mental institutions today, which sounds like a good thing. When you think about mental institutions, you think about Girl Interrupted or One Flew Over the Cuckoo's Nest. Scary places with mean staff and catatonic
But
patients.
it seems like this happens over and over again, Dr. Drew. We miss the warning signs. The warning signs are missed. How do we fix that?
We will. I wish I could answer it in just a minute here on your program, but it's a complex issue. We have issues of mental health parity, and then when somebody dies, they don't look at it as a medical problem. So lack of a bed availability is something that contributed in one of these cases. In the other cases, perhaps there are family members that don't want to acknowledge that somebody has mental illness, or what's very common is caretakers can't require people who are so ill to participate in treatment, even if it means that person will be made healthier, happier, and the community protected.
So, where do people end up? For a lot of them, jail. In 2012, there were 10 times as many mentally ill people in prisons and jails than in state hospitals. And close to 400,000 adults with untreated mental illness are in jails. In effect, prisons are the new mental institutions, which according to the National Alliance on Mental Illness, wouldn't be the case if there were better services.
Anything about it. I have today over 3,000 people in my jail who are mentally ill. At the same time, my police officers are going to doors for people whose rights to own guns and hold them have been revoked, who are severely mentally ill, and yet there's no comprehensive system to do any of this. So the fact that we have tragedies, unfortunately, is what is occurring because people are doing absolutely nothing because there is nothing out there when they leave.
There also aren't enough people to help. There are fewer psychiatric professionals to go around compared to other healthcare professionals. Close to 90 million Americans live in areas with a shortage of mental health care providers, which can mean long waits for treatment or long distances to travel. Insurance companies used to be able to charge higher copays for psychiatric care than for other medical treatments and limit the number of visits, all the way up until 2008, when the Mental Health Parity and Addiction Act forced insurers to cover mental illness equally. But experts say insurers are still finding loopholes. And what about all those people who didn't get access before the law changed? You might go see your regular doctor once a year, but if you need to see a psychiatrist once a week, those copays add up, especially when you're on a tight budget. New rules or not, cost is a real barrier.
There's not enough being done to make mental health care more accessible to people. So my goal in speaking out about mental illnesses is that hopefully one day we can live in a world where mental illness is talked about frequently, people are educated, they're aware of what's going on, having compassion for one another, and also knowing what to do in order to help people.
Stigma against mental illness can hold people back. We often treat mental illness as dangerous or as a character flaw, and the fear of being ostracized or institutionalized is real. That's why admitting you need help is the first challenge, and the second is actually getting it. So isn't it time we have a conversation about mental health that actually leads somewhere, instead of just throwing up our hands?
Because I thought something was wrong with me, I never opened up to anybody. I didn't tell them what I need. Therefore, I ended up self-medicating and coping with very unhealthy behaviors. And now I feel like I've gone through this journey for a reason, and I want to use my voice for more than just singing. I want to raise the awareness so that people can realize that there's nothing wrong with them, that it's just like a physical, it is a physical illness, it's your brain, but you know, it's just like diabetes. You have to find the right treatment for what you have. It's a disease.
And you're not broken.
You're not broken, and there's nothing wrong with you.